CEWA scale. Doctor's orders, where did that one is? Got turned around a bit. So CEWA scale and a MAR, everything got moved. I just want to point out one thing, that your MAR does not have all the generic names. Okay, so if you don't find your med, it might be that it's only labeled generic. So, and you can use any resource that you think of. So, for example, if you like to use your lexicon of the med room, you use lexicon. Because this is the nurse's station, you're in a fishbowl, and then the rest of it is like the therapeutic milieu. Okay? So let me give you a little background about your patient. This is a 68-year-old female who's now admitted to your general psych unit. And she came in the middle of the night, probably like between 1 and 2. She showed up in the emergency room. Well, actually, she came admitted at 12 midnight to your unit. Paramedics were called after a neighbor called 911, and she had a small contusion in her left temporal area. She was admitted to your unit through the emergency room, and they confirmed that she had a negative CT scan of her head. They did a urine for drug screen, and that was all. And they sent her to your floor. The neighbor told the paramedic she hadn't been seen outside for the last 2 weeks because the dog died. She used to go out with the dog. Now they haven't seen her at all. But 6 months ago, her husband had died of Alzheimer's disease. So, and she was the primary caregiver. The neighbor liked to check in on her and had come in about 6:37 to bring her some food because she hasn't seen her. And that's when she found her on the floor in her bathroom, blood on the floor, looks like she fell, hit her head on the sink. Then she looked around the house. There was no food in the house. It was filthy. There were bottles in the bedroom, bottles all over the place. And so this was not like her. Usually she's a very clean person. The place was so dirty. So while in the ED, the patient had said, you know, she drinks about 2 to 3 glasses of wine every night. But recently she's had back pain, and she's been drinking vodka. She's had 2 prior mental health hospitalizations. One was for depression, but that was 15 years ago. And 1 brief detox for alcohol 7 years ago. But no meds, as I mentioned, were given while she was in the ED. So Mrs. Jones has a history of a gastric ulcer and hypertension by history. Her home meds were Protonix 40 milligrams a day and Benazepril 10 milligrams a day. She had an empty bottle of Norco found in her room too, so you know she probably ran out of medication or something. So the night shift, the goal of your LVN is to report off, and I want to make sure, because not everyone read through this, you're going to make a brief synopsis of the patient's background to the RN when given a report. You're going to give the last CEWA score and the last set of vitals done at 4 o'clock. They're written on here. You're going to review labs with the day shift RN, so you're going to look it over here. The patient still needs to have a urine specimen for clean catch, so the night shift nurse conveys that to the day shift nurse. And then Dr. Smith is expected to come in between 11 and 10 to do an H&P. So right now, whatever meds are ordered are all that she has because she hasn't yet been seen for an H&P. The day nurse needs to think this through, prioritize your care. You're coming in at 7. Your hearing report, you get out a report about 7:30. So about the first time you see the patient will be in that 7:30 to 7:45 range. And you're going to have to prioritize what you need to do for your patient. You had familiarized yourself with the physician orders, and so the expectation is that you assess the patient, determine if the patient needs medication, and how to problem solve some of the issues that this patient is having, they present with. RNs, put your delegation shoes on, delegation hat. You're working with another nurse, not in the RN role as an LVN. So there is that possibility you brought another nurse with you, not a CNA. Does that mean they can't do CNA things? No, they can do CNA things, but you're going to be like directing the moving of traffic on this. So if your patients are milling about, that's because it's a psych unit. They may not be in a room, and they may not be where you expect them to be, so you're going to have to, like, don't feel badly about interrupting a conversation or interrupting if there's something going on, because probably about 8:40 goals group starts. So I'm here for questions right now before we get started. Give me these things. You need the charts. So each pair gets one set of charts.
Here you go, team. Are you guys together?
Are you going to give me my blood pressure medication? Because I've been wanting that all morning.
Wait for my nurse.
My blood pressure meds.
Shirley Jones
Now
said.
you're my day LVN.
Alright.
Do we have a name of our patient?
Is that Shirley 7?
Shirley Jones. Do we have a bed? What's your awesome. So I heard that there was a little bit of a mishap last night.
I'm over here. I'm a patient and I'm waiting for my nurse.
I don't know where your nurse
I've been waiting here for a while. It seems like everybody else is a nurse but me.
Yeah, but this is your patient.
So you have a history of hypertension, high blood pressure, and you have headache, you said? And you feel hot?
Yeah, I'm sweating.
Your bathroom. Yeah, I feel kind of hot.
Right. Life is
Oh, I feel like it's like really hot. I'm like sweaty. Can I turn the air up or something?
Huh? What did I say? This is 8:30. 104 respirations are 22. So, Shirley, you asked me if it's just too hot here at 50 this week. Okay, we're going to adjust the air right now. Would you mind going and do that, please? Yeah. Do you feel sick to your stomach?
Oh, these are my freshies.
Can you make sure that those meds come with my blood pressure medications? I don't want you guys to be skipping those.
Sure.
I'm going to be working at the end.
This urine sample looks like it's got urine.
Can you tell me about that?
The doctor's doing rounds from.
This is the 11. They may look used because we had a group before. Okay, so I don't want to confuse you on that.
Or her lifestyle website. So she's ready to take it. And then I didn't give her the family what she was talking about. And then those are just
Yeah, so I can just take it in all at once.
The next phase.
Yeah.
Can I call the doctor? How did you call your doctor?
Yeah. And then we can also use some padding to calm me down, calm the anxiety level down. Does that sound like something you need?
Shirley,
Okay.
how are you today?
I'm doing great. How are you?
Awesome.
So we'll just see what we'll check our results, and then we'll call the doctor if we see what's elevated. We'll also call the doctor about the blood pressure.
But I'll mark it down. No, I can hear you guys talking about me out there.
Sorry, Miss Jones. We're just trying to get you wanted your blood pressure medication. And we don't have the order for it yet, but we're going to get the order from your doctor.
Try to remain calm.
Alright.
You're too excited. That's right. Rusher? I've been waiting all morning.
Mrs. Jones.
I'm just
Patient's really irritated.
Okay, I'm sure he is. And I'm trying to find a 1 milliliter syringe, which I will be able to not to recap. So if I use this one, I don't know how to not recap.
You're not going to recount.
No. So it's not going to be 1.5 right? No.
Is this for the IM injection? Because you would use this for the IM injection. All of them are for IM injection.
Okay, so maybe we don't have any subcutaneous injection. That's the 1 inch, right? So we can do any of them.
Do you have the medication? You have to draw it all here. You don't take this into the patient's room.
So we can use a smaller syringe for time injection. So what is the because time is we have time in here.
There's injectables in here.
It's permitted.
No, this is bed 3. You need more bed 3.
Yeah.
Like, where did you get these? Did you get these?
Yeah,
from
here.
From here.
Right. Or maybe, I got multivitamin. I'm not sure. No, it should be here. I got it from, we are 1B. This. And then we have timing.
I'm so going to need you. You know what? I have 5. Dang it. Okay. Better get his pink.
We got 1 mil there.
This is my drink.
So I need
Yes.
half a mil of methylene.
I didn't catch it. Good.
What? No, I didn't use 3.
I'm running through. Thank you.
Getting aggressive. Go Gray. Give it back.
Are you feeling still a little nauseous? Yeah. I'm sorry. So why don't you stand up for me? I know, I'm being very confusing. So I'm gonna find the site on you. And my LPN here is gonna help me. Do we have that? No. Well, it only needs to be building. So I'm thinking have you done this before? I have done this before. I'm sorry. I know, it's very difficult. So gotta share at the sharing stand.
What is the order card? In about a minute. Your nurse can bring over your medication and talk about all these things. Okay?
So I'll be probably in the deltoid, it would be more absorbent, but for this I need to I was here's your
Okay. So your RNs are getting your meds together. They were verifying more lives. Okay? Any way you can turn down the lights a little bit? They're really bright.
alcohol inside.
Sure. Let's do take your phone.
She already has her meds.
Multivitamin, 1 tab, I need thiamine, 100 milligrams, I need Finnegan, 25, and I need Ativan.
2 milligrams.
Correct. And no need to call the doctor yet, right? Everything's been ordered.
Yeah, you're only gonna call the doctor if your blood pressure was high.
No, that's incorrect.
Has anyone
introductions, please? And go ahead and tell me why you're here, and we'll start with that, just introductions first. And
My
again,
name's Shirley 1B.
Shirley 1B. Okay, we're gonna go in a circle, Shirley 1B, okay? One at a time. We'll start with on my right. Shirley 3. Shirley 3, nice to meet you. And why are you?
Because the neighbor called me in here first in my house, called the cops, and now I ended up here. I don't remember anything, but now I'm here, waiting for my parents.
Okay. All right, and Shirley, your name, your introduction.
My neighbor called me.
Okay.
She said that she was requesting a blood pressure medication. I don't have an order for it.
You get a psychiatrist, a medical doctor, will be in here doing it.
Same thing. And what's your name?
Should I call her?
Shirley 5, nice to meet you. I'm glad you're here today.
Barbara? Is that what I'm doing?
Yeah, I'm Shirley 1B.
Coming in.
Okay, let's try not to use foul language at the group table.
Just anatomy.
Okay. And next to Shirley 1B,
You're welcome.
your name and why you're here today?
I'm Shirley 6. My neighbor called me.
Okay, I'm glad that you're here today. And your name? Shirley 7. Hi Shirley 7, how are you feeling today? Headache. You have a headache? Okay, and why are you here?
I don't even know, I shouldn't even be here. My neighbor called, it was fine.
Okay. Alright. And your name?
Shirley 2.
Shirley 2. Nice to have you here, Shirley 2. And you're
Is it
here.
time for me to go home yet? I shouldn't be here tonight.
It is not time.
No, it's not.
Okay.
My name is Shirley 1A,
Hi Shirley 1A.
and people think I have a drinking problem, but I know it's not. I don't have a problem.
I think I have one too.
Tylenol, what's wrong with that? I fell down last night and hit my head. Which I have a all there, so I really don't think I have a problem. I really don't think I should be.
Okay. Alright, so what I'd like to do next, we all have internet air.
Turn off the light.
Okay. I'm sweating. I'm sweating. Alright, well let's go around. Let's go around and say one goal that we'd like to accomplish today.
Get out of here.
Okay. Shirley 3, would you like to start?
Get out of here.
You want Advan? Have you had your meds this morning?
No, I haven't. I'm still waiting, my head hurts so bad.
Okay, I believe that it is almost medication time, so as soon as we're done with group, if you have not received your medications already, then I believe your nurse will be passing your medications after this session.
What is your name? I was late.
My name is Autumn. I'm sorry? It's spelled A-U-T-U-M.
Were you born in August?
I was not born in autumn. But let's redirect this conversation back to you guys. We're going to go back around and continue on with our goal setting. So I'd like you all to say one goal that you would like to accomplish today, and I would like to not have that goal leave, I'd like to leave, or I'd like to get out of here today. So let's come up with something that will be beneficial to you.